Well, hello everybody on YouTube and welcome to a second in the series of The Truth Behind the Lies. When I produced the first one on a friend Caroline Flack, I didn't expect there to be any others, but given that I'm not impressed by the lies coming from the British government and from what I can see of it, probably governments around the world, I thought I'd produce another one on the subject of masks. Now, obviously, they started off in Britain with the, oh, you don't need to wear one. You shouldn't wear one. They should only be reserved for medical people. So there was a nice little sort of negative thing from them. No, we don't want you to wear one. But then suddenly, out of the blue, it's like, oh, everybody should be wearing one. And of course, you know, the new rules, which again, they seem to lie about and 1 minute call rules and the next minute lie and call them laws when they're clearly not. There will be a third truth behind the lies on why laws aren't laws. But as to the masks, I went to good schools. I learned quite a lot over the years. Obviously, when you go to private school, you tend to get a better education than the average comprehensive. But one of the things that I knew from a very early age was that carbon dioxide wasn't good for you. Now, if you wear any kind of face covering, mask, paper one, fabric one, obviously the thicker the material, the less oxygen it's going to allow for your body to breathe in. It will restrict it somewhat. So I kind of went on the internet and searched, spent a week looking, trying to see if there was any official thing out there where masks had been tested for how much they actually reduce in the oxygen that you breathe in, and how much they reduce the amount of carbon dioxide you breathe out. The interesting thing is, nowhere on the internet could I find any official testing. There's an assumption out there that the N95 mask, which are the medical grade ones, would cut back the amount of oxygen that you breathe in by an assumption of between 5 and 20%. So they assume that, but they've never tested it. So it could be even more than 20%, but that's kind of what they've averaged it at. But they don't tell you how much carbon dioxide it prevents you breathing out, but let's assume it's the same. Obviously, if it limits that oxygen intake by that amount, logic will dictate it would also limit the similar amount, possibly more, maybe less, but it obviously will. Now, if you bother to go onto the internet and you type in what happens if there is too much carbon dioxide in your body, you'll find some interesting information. Comes up with a .gov, which is obviously a original official site, National Lung and Blood Institute. They've got a website on there. That was the first hit that I came across. And obviously it confirms what I learnt at school many years ago and that I remembered, which was that obviously if you have a higher level of carbon dioxide in your body, and that's what we breathe out when we exhale, then it lowers the ability for the blood to absorb oxygen, which obviously as a result of slowing down the oxygen delivery means you've got less of it in your body, in your soft tissues, your bloodstream, your organs and your lungs. But the important thing is that if you restrict carbon dioxide from coming out, and obviously when we exhale, your body gets rid of the amount it needs. And when you breathe in, it breathes in the amount of oxygen it needs. So if you've got anything covering your nose and your mouth, then clearly it's going to restrict that free flow. And higher levels of carbon dioxide do build up in your body. Now the effects of that will mean that you have carbon dioxide in your blood, you've got carbon dioxide in all of your soft tissues, you get carbon dioxide building up in all of your organs, and you get higher levels of carbon dioxide in your lungs. Now, on the official sites, on every medical thing you look at, it says that obviously if you have higher levels of carbon dioxide in your lungs, it will, not may, might or could, will cause lung damage. So it's interesting that the governments of the world are insisting that we all wear masks. When they came up with a double bluff originally of saying, oh, no, no, don't wear them, don't wear them. And then when they say do wear them, it's like, oh, yeah, well, you know, it must be good advice. I mean, initially they didn't want us to. Well, that's really clever because, you know, turning around and sort of trying to convince everybody you don't need to wear one, it's not necessary, don't do it. And then suddenly going, oh, yes, we're recommending you do. That's going to make most of the sheep out there that do what they're told, because they're going to think, oh, well, you know, it's obviously a reason that they want us to wear it. And there is. It's because it will cause you lung damage. And as I say, if you do not believe me, just a guy sitting at home, go on the internet, type in what happens if there is too much carbon dioxide in your body, and then look at the official health sites that are on there, the government.org thing that's on there, Blood and Lung Institute. You know, they've all got this in black and white written on the thing that higher levels of it in your body will cause that. Now, also, obviously you get kind of various different effects from having too much carbon dioxide in your body. It can cause confusion. I've certainly seen plenty of people with a thicker type of masks on acting very confused in a whole range of ways. It will cause depression, it will cause paranoia, it will cause emotional upsets, it will cause irregular heartbeats in extreme cases if you've got too much. So there are a whole range of things that are little telltale signs. Now, I've seen personally people confused, very emotionally upset for no apparent reason over simple little things, all of which have been the mask wearers, interestingly enough. So right from the start of this stupid thing kicking off, I refused point blank to wear one. The company I work for did say that apparently I had to wear a mask if I was in work, and as I turned around and pointed out to them it would endanger my health. No employer is allowed to endanger an employee's health, and if they insisted that I wore one, I would sue the company, and trust me, I would do it. Now, the same thing applies to our poxy government in this country. You can threaten the British public with fines and being arrested and all the rest of it. You don't legally have the right to do any of that because you've not asked us to vote on any of these things becoming laws. You don't have the right to make laws and just thrust them upon the British public when it's meant to be a democratic country. And we are a commonwealth and we have rules. We vote you in. You can't just put yourself in there. You are voted in to represent the British public and to manage the country on our behalf. I remember when I was younger that they used to be calling themselves civil servants, but you don't hear the word civil servant used since about 1980. They kind of got away from that term. Now they seem to think that they own the country, that they own the people, and that they can tell us what and what we cannot do. Now, anybody with any logical sense whatsoever will go on the internet, will type in what I said, will read that for yourself and not just take my word for it, and realise that obviously wearing a mask will damage your lungs. Higher carbon dioxide levels in your body are not good for you, and so you shouldn't be wearing one. You have the right on health grounds, therefore, to refuse to wear one. You cannot be forced to do so by a tyrannical government that thinks it can tell people what to do when there is no logical reason for doing it other than to damage your health. Now, obviously, their nice little get out of free jail card with this one will be that in a few years' time, when all these youngsters that I'm seeing that have got perfectly fine immune systems unless they have an underlying health condition, most of you won't. Most of the adults that get this, most of us or a lot of us have probably already had it anyway. I certainly remember way back in September having all of the so-called symptoms of this COVID thing way before it was even thought of being mentioned that it existed. Had the dry cough that just lingered and lingered. I did lots of colleagues and people in the town that I live in, and I remember people saying, I've got this annoying cough, I've had it for weeks, just doesn't go. Headaches were being experienced by people, including me. Super rare for me to ever have one of those. Woke up one morning absolutely pouring with sweat, felt tired, had the sort of taste thing where things weren't really tasting like they should do. So all of the classic symptoms of this supposed virus that's out there way back in September. Now, obviously, we had it, recovered from it, fine, as would 99% of people that get it. But their scare tactics are that, oh, loads of people are dying. Well, sadly, in this world, loads of people die on a daily basis anyway. Mostly, obviously, elderly people just get to a certain age and they die. It's sadly going to happen to all of us, me included, one day. We don't have a time frame of how long we know we're going to be here for, but people do sadly die by the thousands every single day. Lots of people have got health conditions, and yes, if they get another thing like this, then it could, and probably would, aggravate their existing health condition, could make them seriously ill and make them die sooner. That would happen with standard flu. To be fair, even something as simple as a normal cold could be seriously lethal and dangerous and develop into pneumonia, for example, if you have underlying health conditions, if you are on medication which will seriously suppress your natural immune system, for example. So it's not a big deal. It's nothing to panic about. Most people, when you look at statistics on the internet of the countries that are saying how many cases they've had reported, and the few things on there where they do actually give recoveries. Sweden, for example, I looked up theirs, 85,000 cases reported, 80,000 people recovered, allegedly 5,000 deaths. Half of those are probably going to be natural causes anyway, but because the person actually had COVID allegedly, then, oh yeah, they've died of that, but then they probably would have died naturally anyway, so you can easily half that number. So it's an interesting one that, as per usual, humans with no logic overreact to everything. I find it interesting that when we had Chinese flu back in the 80s, seriously kind of nasty version of the flu, people were like in bed for maybe 3 weeks with it and having antibiotics and all the rest of it. Nothing like this kicked off with them going over the top and insisting you wore a mask. We had the SRA thing. There was that one where there was this super bug that was unable to be killed, that was in all hospitals, and nothing we had could get rid of it. MRSA one, I think that was. And then a couple of weeks in, oh, actually, yeah, normal bleach kills it, and normal disinfectant kills it, and we weren't just cleaning our hospitals properly, and yeah, you can get rid of it. Typical overreaction by everything. But I'm intrigued why all the governments of the world are insisting that we wear masks when they know it will damage your health. Now, as I say, I think their personal thing there is that there's a good reason why they'd want to do that. I mean, I remember not long ago they turned around and said that there was a much larger population of elderly people going to be coming up in a few years' time because we were living longer. That cost them billions and billions, trillions probably, of pounds in healthcare throughout the world, pensions throughout the world. So if they could make you have lung damage when you're younger, and in a few years' time that progresses into maybe lung cancers or emphysema or a whole range of other diseases that affect the lungs because your lungs have been damaged, and you go to your doctors and you say, well, how did I get this lung disease? I mean, I've never smoked, for example. I've never worked in an industry with toxic chemicals or toxic paints. And they'll be able to go, yes, you see, but of course a few years ago we had COVID, you must have had that, and that's what it was that's caused the lung damage. You probably didn't have it, or you probably did have it, and you've recovered from it, and you've been fine. It'll be wearing the masks that they're insisting you put on your faces that will 100% limit the amount of oxygen you breathe in, which is why you feel stifled and more tired and find it harder to breathe. But because your body is exceptionally good at being able to acclimatise itself to stresses and strains, it will get used to the fact that you are breathing in slightly less oxygen, and get used to the fact that you've got higher levels of carbon dioxide in your body than you should have, and you'll kind of get used to it to a point. But it's not good for you, it's not healthy for you, and all you've got to do is just type it in to your little mobile devices or your laptops and read the same thing that I've read, which I also learned years and years and years ago when I was younger at school. and remembered. Now, the sheep out there that just do what they're told by a government they vote in, who they seem to think have the authority to tell you what to do, well, you're probably just going to do it anyway, and that's fine. I mean, as one stupid woman said to me the other week, oh, I'd rather have lung disease and get COVID. Yeah, really, that was what some dozy bitch said to me. Oh, fine, yeah, just get on with it, you deserve to die. You know, obviously free thinkers out there, people that have a brain and actually it still works logically, then you will realise that wearing the mask isn't good for you. That wearing the mask is just kind of like something they're telling you to do because they know it will damage your health. Now, as I say, up to you. I'm refusing point blank to do it. I'd like to see them try and arrest me for this or fine me, because I'll be telling them what they can go and do, and I will fight back with a passion for eternity and get seriously even if they even contemplated going down that route. The British public and anybody else out there that's watching this needs to know the truth. And the truth is that, like any virus, human body can cope with it perfectly well, providing you've got a decent immune system, and most people do have. Yes, there are vulnerable ones with lower immune systems for health reasons, or medication that you are being taking for different things because the medical profession is going, oh, have this and have that, which always causes side effects of one sort or another. But the vast majority of people around the world will be fine. And that's the truth. And I think most people around my town have actually realised this one. Because when I look on the street, I see the mask wearers and all of the weird stuff that's going on with them, where you sort of say, yes, you go out through the door on the left. And as they walk to the door, they push the door on the right. And you think, interesting. You know, or the woman on a phone just trying to sort out a prescription that then bursts into tears and gets super emotional about it. And I went, wow. Wearing a really, really, really thick mask, which she probably puts on at the beginning of the morning when their eyes open and takes it off at night. And you're thinking, yeah, panic attacks, emotional upset, paranoia, depression, confusion, higher levels of carbon dioxide in your blood. Not surprised. So, that's what the truth behind the lies is for this particular episode. And I've enlightened a few of you. And some of you will ignore it. No doubt there'll be idiots out there making stupid comments. Really don't care. You know, not bothered about that in the least. But at least I've actually put down facts, which you can check. So that's up to you. Thanks for watching. See you in the next one, maybe.